Hi, welcome, and thank you for tuning in to North York General Foundation's House Calls, a conversation with our community. My name is Megan Ogilvie. I'm a health reporter for the Toronto Star, and I'm really happy to be here to host the fifth event in the House Call series this evening. It's called COVID-19, Vaccines, Variants, and to the Future. For the next hour, we will be talking in a conversation about the pandemic and what the months ahead could hold for you and your family and your community. But before we get started, I'd like to remind you that any advice offered this evening is not meant to replace that of your own physician. And of course, if you are experiencing any COVID-19 symptoms and are worried, please go to your family doctor. Please feel free to submit your questions for the panel through the Q&A function on Zoom. We will be taking a break every little while to take some of these questions and also respond to those submitted in advance. Now, let me please introduce you to our panel this evening. First up is Dr. Kevin Katz. He's Medical Director of Infection Prevention and Control at North York General Hospital. He's a medical microbiologist and infectious disease specialist and has been leading the charge on the hospital's COVID-19 response right from the beginning. Tonight, Dr. Katz will talk to us about the evolving COVID-19 situation, so we know it's always changing. He'll also talk about infection rates and modeling, variants of concern, and what the fall could bring us as we see the fourth wave. He is, Dr. Katz, a wealth of information on this topic and will have lots of insights for us.
Thank you so much. It's great to be here.
Now you might recognize Dr. Ronik Kanani, Chief of Pediatrics and Co-Medical Director of the Maternal, Newborn, and Pediatric Program from our last House Call session. Dr. Kanani's focus is on overseeing care for North York General Hospital's youngest patients, and he will provide perspective on what is the latest wave could mean for our children now that they're back in school. He'll also share his thoughts on vaccines for young kids.
Thanks, Megan. It's great to be here tonight.
And lastly, I would like to introduce you to Dr. Maria Muraca, Medical Director of the North York Family Health Team and co-chair at the Primary Care Advisory Council at North York General Hospital. She has been one of the hospital's vaccination clinical team leads and has been instrumental in the hospital's vaccine rollout, where more than 250,000 COVID-19 vaccines have been given. She will also provide a view into the continued vaccine rollout, what we could see in the coming months with booster shots, and what the rollout could look like when vaccines are approved for younger children. Thanks for being here this evening. Hope we're going to need you to take your mute off, Dr. Muraca.
I knew I'd do it once. Thank you so much. It's my pleasure to participate in this tonight's session.
Okay. All right. Well, to start, we're going to hear from Dr. Katz. He's going to provide an overview of the current COVID-19 situation.
Much, Megan. I'll keep it short because I'm sure the questions will dig into all of these hot topics. But essentially, as we've all heard, I think we're at the beginning of the fourth wave, which is being caused by the Delta variant. The problem with the Delta variant is that it's really tremendously contagious. If we look back, the original, I'll call it the Wuhan strain, it's not the correct name for it. The Wuhan strain gradually evolved into the Alpha strain, and that was about 50% more contagious. And then the Delta strain came along and is 50% more contagious than that. And so what that does, when you look at the mathematical equations around what herd immunity level or what level of population requires vaccination to be able to break the cycle of transmission, is it takes it from around 70% up to above 90%. So if we still had the original strain, we'd be good right now. But the virus is smart. It's actually smart by not being smart. It constantly makes mistakes as it's replicating itself. And those mistakes add fitness over time. And so we're stuck with a virus now that is extremely easy to pass from person to person. And unfortunately, we have about 20% of the eligible population that's not vaccinated. And so when you combine the fact that unvaccinated people are about 5 times more likely to get infected and about somewhere between 11 and 18 times more likely to require hospitalization and ICU care because of that infection, that leads to problems. And the Ontario Scientific Advisory Council or Committee is looking at mathematical models, which are showing that this wave can be pretty much as severe as the last wave at the peak. It's modeling without changing the level of vaccination and public health measures that will end up with about 900 plus people in our ICUs if we don't change the course. So hopefully we'll be able to move the needle with the vaccine passports that are coming in and all of the different mandates. And tonight, I'm happy to answer any lab type questions. We can talk about booster doses. Yeah, I come at it from the lab side and the clinical side, so happy to take any questions with my colleagues.
Okay, thank you. And thank you for the overview. We know that COVID has been a challenge since the beginning and is always evolving. So thank you for telling us what we might expect this fall. Dr. Kanani, do you want to take it from here and share how this wave is impacting children or could impact children? And now I know with lots of parents having their kids in school, what does that mean for young families?
Sure, thanks, Megan. So I mean, currently with children, I mean, I think things are sort of getting back to normal for kids. I mean, they finally have gone back to school, which is great. I think most kids had a really good summer where they were able to attend camps and do a lot of outdoor activities. So I think that, you know, overall things are much better right now for kids than they were several months ago. In terms of COVID, I mean, we have been seeing some kids with COVID in the hospital, but it's been really minimal. I tried to pull the data around how many COVID admissions we've had since the start of the pandemic, and we've only seen 12 or 13 hospitalized kids with COVID at North York General. So there haven't been that many. Certainly they've come through the emergency department and we have seen kids test positive, but generally they've been quite mild. I think the one thing that we've seen that's been a bit different in the third wave and also at the start of the fourth wave is that certainly there are some teenagers that are getting quite sick from COVID, especially unvaccinated teenagers. So it's really important to promote the vaccine for those 12 and above who are eligible for the vaccine, because certainly we have seen some sicker teenagers. I think the other thing, just to highlight in terms of how COVID has affected children and teenagers, one thing that's, you know, we've seen a lot of is teens with mental health conditions and eating disorders. We sort of call it our shadow pandemic. So we've been seeing a lot of that in the last year and a half, and we're expecting that that will also continue. In terms of what to expect with schools reopening, I mean, certainly we will see an increase in COVID in children. When we look at the US data, there's a lot of kids that have been affected recently with COVID. So I think we're going to be closely monitoring that. We're certainly doing a lot of planning in Toronto and in the GTA in collaboration with Sick Kids to plan for a potential surge with pediatric patients.
Okay, thank you for that clear response, Dr. Kanani. And now, Dr. Maraca, let's chat about the vaccine rollout. You've been so critical in that for the North York General Hospital. I know that that's probably lots of different moving parts. We're in Ontario, about 78% of people older than the age of 12 are now fully vaccinated. But, you know, can you tell us what we've learned from the initial rollout and where we go from here? You're going to want to unmute again.
Thanks, Megan. Sure. You know, I've been very fortunate to work with a great team here at North York General Hospital and our North York Toronto Health Partners, our OHT, to roll out a very robust vaccination strategy over the last 8 months, from mass clinics like Seneca to smaller local park type clinics at Avondale, shelters using a bus and even my bike. We tried to get to as many patients as possible and really trying to find the patients where they are to offer the vaccine, making it as easy for them to do so and trying to avoid the barriers that might have prevented patients from getting there. Some patients found the mass vaccination clinics very difficult in terms of getting online and booking appointments, needing help to do so, or some were fearful of going into large spaces after being, you know, in their homes and told not to leave for so many months. So we really tried to tailor to each type of patient going to different places. We created a homebound vaccination program where we targeted patients that couldn't leave their home for various medical reasons and making it easy for them to get the vaccine, with them being even more vulnerable. So we anticipate that moving forward, we will continue to do this really patient-focused approach to vaccinations for the fall, whether it's in terms of getting booster shots or vaccinating the young under 12 population. We've already started giving some booster shots at various clinics, including our North York Family Health team, for those patients that are eligible, namely those who are immunocompromised. And we are partnering now, our Ontario Health team, our North York Toronto Health partners, very closely with Toronto Public Health. So we're continuing a lot of the school outreach and school-based clinics. There are some mass clinics that continue through your local public health unit. And again, going to where patients like to be on their spare time, just to make it easy for them. So multiple local clinics running even this weekend in our community spaces like parks and centers.
Thank you for that. I know that was just a tiny little microcapsule of what you've been doing for the last 8 months, but thank you for laying it out. Now we're going to hear your questions and have this panel answer them for you. We've had lots of questions come in through in advance, and we're still seeing them come in through the Q&A, so thank you for that. And if you do think of a question as we go forward, please submit it through the Q&A function on Zoom, and we'll do our best to get to them all and get them to the right, I guess you're all the right panelists, but to a panelist here to answer your question. So our first question comes in, again, I think Dr. Kanani, you mentioned this a little bit earlier, but perhaps you can go into more, a little more detail. How does the Delta variant affect children? And I think a question many parents would have is it more dangerous than the original strain for this younger population?
Sure, yeah, happy to answer that question. I think as Dr. Katz mentioned, I mean, the Delta variant is certainly far more infectious, but what we know about Delta variant in children is that it's not necessarily more dangerous. Certainly in the US, they've been closely looking at this information, and I recently read the data out of the US. Certainly the number of kids and adolescents affected is much higher, but the severity in terms of ICU admissions is not necessarily higher. So I think we definitely will see more cases given the fact that it's more infectious, and just that is a large group of unvaccinated children. So we will see more cases given how infectious it is. But I don't think it's more dangerous. The one thing that I did read was, hospitalization is definitely probably about 10 times more likely in an unvaccinated adolescent compared to a vaccinated adolescent. So that proves how vaccines are really important for youth.
Yeah, thank you for that reminder for that population. Dr. Katz, we've been hearing a lot in the last few weeks about boosters. Is the booster vaccine necessary? And for those of us, I know some are already being given out to vulnerable populations, but when is it likely to be available for across the population?
So there is a lot of talk about boosters, and I think part of what's driving the conversation is what's happening in other jurisdictions. So let me frame it so that people understand the different pieces of the puzzle that go into that decision. So I think it's clear now that as you get further away from your second dose, that the antibody levels gradually fall, and that the chance of becoming, I'll say, infected, and I'll describe what that means, increases the further away you are from your second dose. So if you're 5 months, 6 months, 7 months away from your second dose, the chance of having a lab test positive with mild symptoms, that could just be a low-grade fever or aches and chills, is higher than 3 or 4 weeks after your second dose. And so that leads to a discussion about requiring a second dose to try to reduce the chance of having a lab test positive mild symptomatic infection. So there are countries that have moved forward wholeheartedly across the entire population. Israel has done that. The CDC in the United States has essentially recommended for everybody over the age of 40 that's 5 months past their second dose that they should receive a third dose. Here in Canada, the National Advisory Committee on Immunization has essentially said that for immunocompromised populations, people with transplants, severe immunodeficiencies, cancer, those type of severe weakened immune systems, that they should receive a third dose because there have been descriptions of severe infections in people who had received 2 doses. I have a lot of healthcare workers myself included, my spouse, and all of my colleagues, we all got vaccinated essentially in January. So it's been a long time since we've received our doses. They all want to know when they're going to get it. And essentially what the data shows is, yes, we may be more at risk of developing a mild infection, but the risk of us being admitted to hospital or requiring intensive care continues to remain low, regardless of third dose or not. So the 2 doses, even if the antibody levels fall, they do protect you against the severe end of the disease spectrum. And so the ethical piece that's woven into this conversation, and the reason that the World Health Organization is pleading with rich countries not to move forward in a major way with third doses, is because the manufacturing capacity for doses in the world is fixed. And while rich countries have vaccinated more or less everybody who wants to be vaccinated and are pleading with the last remaining 20% or so that haven't received it, there are places in the world where people have not received 1 dose, where healthcare workers haven't received 1 dose, where elderly people have not received 1 dose. And so if the rich world sucks more doses out of the system, then it will worsen the situation in the developing world. And so I don't have an answer to your question because there's a huge political aspect to it, and policymakers need to weigh in on it. And I don't actually know how it will play out. I think the more countries, the US, Israel, Germany, that start following the UK, the more likely I think it is that there'll be pressure on Canada to move. But the reason that it's been silent is because I think they're trying to follow the World Health Organization's guidance so that countries which truly have 80-year-olds who have a 20% death rate, to let them get their first doses before we all get our third doses when we're actually protected from severe complications.
Thank you. I know we'll be hearing more about that in the coming weeks and months. But right now, I think one of the other big conversations we're all having, either in the media or with our friends and family, is about those that we know who have so far chosen to not be vaccinated. Dr. Maraka, I'm wondering, when you're talking with someone who might have a vaccine hesitancy, what kind of things can we talk to that person about? What can you use in a discussion to help them make a choice to have a vaccine at this point in time?
Thanks, Megan. This has definitely been very challenging, an important piece of the puzzle in terms of reaching the remaining 20% of unvaccinated patients. My approach really is to meet my family, friends, and patients where they are, letting them know that I'm really there to support them in their decision and not convince them to be vaccinated. A lot of patients have been feeling coerced and forced into getting vaccinated because of a lot of the workplace changes and mandates and travel mandates. And so that really doesn't resonate well with them. And thus their immediate reaction in some cases has been to be even more resistant to having discussions with some people who they might feel are very pro-vaccine. Underneath it all, a lot of my patients have been very fearful about what the long-term consequences are. And another piece is the worry that the vaccine may worsen their pre-existing medical conditions or incite something new to happen. Quiet thyroid nodules suddenly might become larger. And so really dissecting their concerns and getting to the bottom of their fears has helped in many instances with my patients, really showing them that even if some medical problems, even if we find out that down the road it might have made something a little bit different or worse or changed a small lab value, this could potentially save your life. So you will learn over time that what we're dealing with now is really the important piece of reducing your risk at this moment. And there haven't been any other types of data at this moment to tell us that the risks are greater than the benefits. I try to offer the anecdotal experiences with my family, my friends, that it can be very difficult to make the decisions, including myself, as all the information has been so rapidly evolving, and that we're learning in this moment in real time together about what's happening with the pandemic and the vaccine. And And so sometimes when we make changes to the recommendations, including, potential vaccines, that does also give a little bit mistrust among some of my patients. So again, reminding them that we're really doing our best in this moment to make the right decisions to keep them protected. And what we know is that we have this incredible tool at this moment to prevent them from getting very sick and dying of this disease. And that really, we can't predict exactly who will land in trouble. So by not getting vaccinated, they really are rolling a dice and taking their chances. You could have very mild asymptomatic disease too, but if we have something to prevent you from getting sick and potentially avoiding the long-term consequences of COVID, we should be using it.
Thank you. It sounds like listening closely and with empathy is key here, and also speaking to a trusted medical person in your life, your family physician, your nurse practitioner, to answer those. As you said, some people might have some very specific questions that they need answered. So thank you. We knew that there'd be lots of questions from our audience coming in today, and I've got the first live question. Because it was, I'm going to direct this to you, Dr. Katz, because you most recently were talking to us about booster shots. This question is, I would like some more info or information on the future of potential booster shots, and if there are issues for those of us who suffered a severe vaccine reaction the first or second time around, such as myocarditis or pericarditis. Do you think we should, for those of us where this is a very particular situation, should we obtain antibody testing at intervals to help us answer this question?
Yeah, so I think the question around a severe complication of vaccination, like a documented severe case of myocarditis or Guillain-Barré or something like that, a neurologic complication, I really do think those have to be a one-on-one, case-by-case conversation. It's hard to generalize, but those are probably among the very, very few absolute contraindications to vaccination. Allergies would be the other. All of the rest of it, sort of severe reaction where you have aches and fevers and pain, sore arm, not feeling great, sore throat, myalgias, all those things are almost expected reactions and are well treated with Tylenol or Advil and get them under control. Wouldn't be considered allergies and certainly wouldn't be considered contraindications. Right now, the two main workhorse vaccines that we have here in Canada, AstraZeneca is sort of aside, Janssen vaccine really hasn't come here. They're two mRNA vaccines. There probably will be additional vaccines that will come into our armamentarium. One of them will be a protein antigen-based vaccine, similar to the flu vaccine eventually. And so I can't predict the future on how this will play out, but it's possible that those new more conventional vaccines or more long-term tested 20 years, 40 years, that maybe those would be recommended in people that have had some of these reactions to the vaccine. I think the other thing to recognize is, and no one really talks about it, public health hasn't really conveyed the message very well through the media, but this is not a virus that's going away. It's going to be a human virus for many, many, many years to come. Essentially, this was an animal virus. You never get your dog's cold virus, and the dog doesn't get it from you because there's species specificity on the viruses. They don't jump species very often, but when it happens, this is what happens. So it came from bats into humans, and now it's very successful in humans. And so it's now de facto a human virus. And so when we get infected or when we get the vaccine, essentially we develop some immunity, which is what's going to bring it under control. And it probably will be a seasonal virus, season after season after season, into the future at a much milder level, because we all will have some immunity from either natural infections or the vaccine. And that's really the end goal of this whole thing, is to have the whole human population have some immunity, so that yes, it will cause common colds and some mild illness, but it won't put large numbers of people in the hospital or on ventilators.
Okay, thank you. So it sounds like, again, for this specific question, if they have questions about how the booster should might affect themselves is to talk again to their family doctor, as you said, to get at those very specific questions. But here's a broader question that was sent in a little bit earlier, again for Dr. Katz. What is the likelihood of an unvaccinated person getting COVID and infecting others compared to someone who is vaccinated against the virus?
So this part is a little bit confusing, so I'll say it rather precisely. People who are vaccinated acquire the infection at a much lower rate than those who are unvaccinated. And that was the number that I said, that unvaccinated people get infected, lab test positive with symptoms. They get infected about 5 or 6 times at a higher rate, 500 or 600% higher than vaccinated people. The confusion I think that's coming is, and it's true, is that when vaccinated people do actually become infected, and there still is a small risk of that, particularly in very close contacts, spouses who are in the same household, you can be vaccinated and have a mild infection, be lab test positive, and you can be contagious to others. And with the Delta variant, it appears that that risk of passing it on when you're infected is similar in vaccinated people as in unvaccinated people. So that doesn't mean that vaccination doesn't affect transmission, because again, you're 5 or 6 times less likely to get infected. But if you're that unlucky person who is vaccinated and gets infected, you certainly can pass it on to others.
I'm going to just jump in with my own follow-up question. So when we talk about mask mandates, can you just explain to us why it's still important, why we have public health measures such as mask mandates, even for those of us who are vaccinated?
So masks do 2 things. Masks can either be considered personal protective equipment, where they protect me from you if we're interacting in close quarters, or they can actually work as a source control device, meaning that I have something and it catches the droplets from my nose and mouth and prevents them from coming out and causing problems for you. And so the mask mandates of all of us wearing masks, it's actually the latter that is the bigger benefit, where when I'm wearing a mask, it prevents me from shedding virus into the local environment around me, generally within 2 meters, and causing you a risk of becoming infected. So that's the rationale until the vaccination level gets up to a level where it breaks the cycle and 100 cases becomes 80 cases, becomes 60 cases, and eventually it sort of whittles down so that there's just a very low baseline level. The masks adds an additional benefit to breaking that transmission cycle while we know that the virus is still circulating in moderate numbers now and increasingly so.
The next question follows a little bit along this line. So for all of us who have children in schools, for the most part, there are universal masking in schools. What additional infection control measures does the education system need to make in order to minimize the risks of further school closures? And I think Dr. Kanani will put this question to you.
Yeah, thanks. I mean, I think that schools are already doing quite a bit to try to reduce transmission in terms of the mask mandates, good hand washing. I think that all those things need to continue. I know they're also working on improving ventilation in the school system. I mean, I think in terms of what further they could do, I mean, they could consider mandatory vaccination for teachers, also for youth above age 12. I mean, you know, I think it's not mandatory right now, but certain vaccines have been made mandatory in the past, even for students. So that's something that could be considered. But I do think that schools are trying their best, but there could be these added layers that they could consider in the future.
Thank you.
If I could just jump in, I just want to, I mean, we all have kids, and I mean, if we go back to 2018, 2019, we've all been there where, you know, your kid is supposed to go to school, you're supposed to go to work, and then the kid has a mild illness or not feeling well, and they, you know, give them a Tylenol, they're good to go, and then they ship them off to school. This is back in 2017, 2018 type of era. I think it's really one of the biggest things that we can do is to keep kids who have symptoms and are unwell home, and that's true for adults going to work as well. The number of times that I've heard people say, oh, I have allergies and go to work or go to a religious congregation or something like that, you cannot tell that it's allergies. The only way, there's studies done in influenza, there's no way to tell except for with a test, whether it's allergies or an infection. So I would just add that to everything that that Ronak just said, and I'm in wholehearted agreement with him.
Thank you. Our next question is probably one that we all have. Sometimes I wonder if I should travel down the road to my restaurant, but if you're wanting to travel further afield, Dr. Moraka, what are your recommendations in this fall from the fourth wave when it comes to travel?
Yeah, so, we've all been so eager to get away and enjoy vacations again with family and friends. However, really, it's still not so easy or possibly safe to do so just yet. The Public Health Agency of Canada is still continuing to advise travelers, regardless of their vaccination status, to avoid non-essential travel outside of Canada. If you really do have to travel, it's really important that you receive both vaccinations as a big layer of protection. And now it's actually required by many airlines as well. You should really pay close attention to the pre and post requirements at the destination. So in terms of testing and possible quarantining upon return. Pay close attention to the COVID-19 situation at your destination too. It's changing very rapidly, and if numbers are quite high, it might also be a deterrent to traveling there. Of course, don't travel if you have any COVID symptoms. If you're waiting to get a test result, if you've been in close contact with somebody who's tested positive, try to do your part in terms of preventing that transmission. Imagine you being on a plane and potentially spreading it to others. Also, it's not fun to think about, but you should always consider the availability and potentially high cost of needing medical care in that destination should you fall ill and need to remain there for medical treatment. Again, all the same IPAC and infection control procedures, make sure that you're layering these efforts. So in addition to the vaccine, you're wearing a properly fitting mask, bring some sanitizer, I keep them in every single pocket now and purse. Think about if you're traveling for pleasure to avoid high-risk situations where there might be lots of crowds, like large performances, busy bars or sports events, traveling in a crowded bus. My son and husband wanted to go to a Blue Jay game in Boston next weekend, and I quickly nixed that. So high-risk situation, uncertain times. I think it would be safest for all if we sort of thought about just pausing those types of vacations that are not truly needed at this time.
Thank you for that. Yes, it does seem like we're still not quite back into pre-pandemic. Well, we're definitely not in pre-pandemic times, but even like not even close to getting on the runway to pre-pandemic times. Right. Here's a question, it's something I've heard a lot in my health reporting too from people. They want to know, now that we're 18 months into the pandemic, are there other therapies to treat COVID? If you get sick with this virus, some people will have mild illness and moderate illness can recover at home, but for someone who has more severe symptoms, have any new therapies emerged to treat COVID? Who would like to jump in here? Who's the best to answer?
The short answer is yes. For those individuals who end up in the intensive care unit on ventilators or even worse on heart-lung machines where their blood is actually being taken out of their body, oxygenated and put back in. The severe end of the spectrum, essentially medications are given that turn down the immune system, which sounds counterintuitive because the virus is what's actually triggering the whole event. And if you turn the immune system down, intuitively you'd think that the virus replicates up and causes more problems. But often the severe end of the manifestations actually relates to the immune system going haywire and actually causing a lot of the damage to the lungs and inflammation in the entire body. And so using things like steroids was one of the early ones, and now there's some of these antibody based therapies that are new, and they're quite expensive, but they work very well to actually turn down the immune system, and patients do much better. There's other ones on the horizon, but those are the big themes that are used almost universally. And I mean, the pandemic obviously causes huge numbers of people to be ill, but as we've all experienced with our purchases on Amazon and in stores, the whole supply chain in the world has come under pressure. It's getting a lot better now, but a lot of these medications were under severe pressure during some of the previous waves, and so some hospitals were getting close to running low on some of these things. I suspect that won't be a problem moving forward any longer, which is a good thing. But there was a couple of nail-biting moments in the past year when some anesthetic drugs, basic drugs, or some of these newer therapies were running on the low side. So I think the good thing is that's probably behind us now.
Dr. Mraka, for the people who have the mild or moderate symptoms of COVID at home, is there anything that you would recommend to a patient who called with that question, what they can do to make themselves feel better while they recover?
Sure. So a lot of the same principles that we would advise with other, upper respiratory tract infections that have been circulating in the past. So lots of rest. So your immune system is working harder to get rid of this virus. Rest really helps make it stronger and get rid of it faster. A lot of fever happens, so bringing the fever down for comfort and getting rid of some of those symptoms. So analgesia, acetaminophen, or ibuprofen for fever is a great idea. And fluids. So we know fluids do play a big role too in keeping us hydrated, because when we get sick with these viruses, our body is often getting quite dehydrated, and sometimes patients end up in hospital, not necessarily from the effects of the virus, but the dehydration that it imposes. So keeping very well hydrated, even if your appetite is down and you're not so hungry, lots of fluids on board. And then really protecting the others in our family, especially if you have any that are higher risk of getting more sick with any particular virus. Trying to segregate yourself, wash your hands frequently, and keep those other people protected, staying home and not traveling if you don't need to.
Okay, thank you. I think that will help people at home, in their minds, trying to understand what they might do in a situation should they ever get COVID. Dr. Kanani, we haven't heard from you in a while, so I'm going to put the next question to you. I think parents are already thinking about this question, even though vaccines are not yet approved for this age group. How will they know, or how do we know that vaccines are safe for young kids? And how can we, or the drug companies and the approval bodies, determine the long-term side effects of the vaccine on children when it is something that is new?
Yeah, no, I think that's a really good question. I mean, currently the COVID vaccines, Pfizer is approved for 12 plus, or those turning 12 this year. And certainly we do have a lot of data on that age group. It is considered very safe for that age group. The one thing that it's a rare side effect that they have seen is something called myocarditis, which is inflammation of the heart, but it's an extremely rare side effect. We have not seen it very often. Otherwise, there really have not been any concerns around the safety of this vaccine, at least in teenagers. In terms of younger kids, so both Pfizer and Moderna, they're doing trials right now on younger kids. In terms of the Pfizer vaccine, it's expected that we'll probably get data very soon on the 5 to 11-year-olds. And again, they're studying the safety, and in terms of what they're doing with that age category is they're actually using a lower dose of the vaccine. So they're using 1/3 of the dose that they're giving to 12 plus for the younger children. So we should probably get that data sometime in the next month. I expect we'll get the data on 5 to 12-year-olds, and then we'll see if that gets approved. I know that they are following them for at least 2 months after the second dose to determine any short-term effects of the vaccine. In terms of longer-term effects, I think it's extremely unlikely that we would see any long-term effects from these vaccines. We don't see that from a lot of other vaccines. I know this is newer technology, but we really don't think that there would be any longer term effects from the vaccine.
Okay, thank you. Dr. Katz, I'm going to put this question to you. Should non-essential workers return to the workplace now that variant now that the Delta variant is here and we are seeing increasing cases and increased hospitalizations? What do you think about those of us who work at desks and not have had to go into the workplace for the last year and a half?
I think it depends on the setup of the workplace. It depends on the vaccination levels within the office. So it's hard to give a sort of blanket statement across the board for all workplaces. But I do think fundamentally that we need to think about the recovery plan and how we're going to get back to a normal situation in the longer term. So over the summer, there was not a lot of COVID. Should people have been getting back to work and interacting with their colleagues and normalizing the situation when there's not a lot of COVID around? I think the answer to that is yes, with infection control measures, social distancing, masking, hand hygiene, and then some engineering controls within the office. You may not have two people facing each other at one desk. You may have them back to back, away from each other, distanced more. Maybe there's plexiglass barriers. Maybe you split the workplace up and some people go Monday, Wednesday, Friday, and some go Tuesday, Thursday. So there's creative ways to deal with each workplace. I think the vaccine mandates, once everyone's vaccinated, I think that will add a huge safety layer in workplaces. But the goal of all this, again, is to get everybody having immunity, ideally from vaccinations, if not from natural infections, because I know people who are afraid to get vaccinated are sitting at home, and it's not that they're anti-vaxxers, they're afraid to get vaccinated. And they're sort of hibernating at home thinking that they can avoid the virus. This virus is not going away. Eventually, everybody will get infected with it or vaccinated. It's sort of one or the other. It's just a matter of time. So once everybody has some immunity, we need to get back to life. The hospitals being overwhelmed is the biggest risk here. And once everyone has immunity, we won't see all these severe numbers happening all at once in big waves.
Okay, thank you. I'm going to jump in with a question here for Dr. Maraca. It has to do with immunity. And the question is natural immunity just as effective as the vaccine? Why or why not? And are there studies about this?
Great question, and really following up on a lot of what we've already mentioned in terms of getting the vaccine or not. And we're really talking about natural immunity versus vaccine-induced immunity. And we're aware of lots of reports indicating that people who were previously vaccinated with previously diagnosed with COVID getting reinfected. And this isn't unexpected based on what we know from other viruses, including other common coronaviruses. The immune response once you've gotten COVID varies from person to person, depending on the severity of the illness that you've experienced. And the duration of immunity is really variable as well. Mm-hmm. So we don't know exactly what that means for everybody after infection. It's very different. And so that compares drastically to what we know about the vaccine. So all the studies know, we've studied that this dose of antigen in this group of patients mounts this type of immune response. It's predicted, and we know that that actually is what is reducing the hospitalization rates and death. So you do get better protection being vaccinated. One study showed that unvaccinated people who already had COVID were more than 2 times as likely than fully vaccinated people to get it again. Furthermore, the strain that you might have received in that first infection may protect you somewhat from other strains, but we definitely know that the vaccine will cover you for all the strains at the moment in different ways, but again, impacting and preventing severe hospitalization and again, death. So all signs are pointing to the vaccine giving you the best type of protection and the most predictive type of infection compared to the natural immunity.
Okay, thank you. Adding another question here, I think will be really important for people in the population who received 2 doses of AstraZeneca back in the spring when this was being offered. What happens for these people, for the people who chose to have the 2 AstraZeneca vaccines, especially when it comes to needing a potential booster? Dr. Katz, is this best suited to you?
Sure. So again, there's a couple of different ways to look at the question. And the hardest one is, what will governments do when they're requiring vaccine passports in terms of accepting 2 doses of AstraZeneca and then a dose of mRNA vaccine? I don't actually know, because each government gets to decide what they want to do. Just as an example, Israel was accepting 2 doses of vaccine from other countries. And if you had 2 doses, they would eliminate quarantine on the way into the country. And apparently now they've required quarantine for all foreigners, even if you've received 2 doses, until you get a 3rd dose upon arrival into the country. So again, it's very, very fluid. But the scientific answer to the question, taking out policy and politics, because I don't know how those things play out, there's no problem crossing vaccines, even from 1st to 2nd dose, or certainly for the 3rd dose. If you think about influenza vaccines, we get that every single year. And you probably don't even ask what kind of influenza vaccine you've received last year or the year before, but there in fact are many different brands of vaccines. Some of them have adjuvant, some of them don't have adjuvant, some of them are high dose, some of them are low dose. And it's no problem to cross manufacturers. Ultimately, all of the vaccines are doing the same thing. They're trying to expose your immune cells to a protein that mimics the spike protein on the surface of the virus. So that can be done by directly giving the protein. That's a vaccine that doesn't exist in Canada yet, but will be coming soon. Or the AstraZeneca and the Janssen essentially uses sort of a hollow virus particle to deliver that, and then your cells manufacture that protein and your immune systems react to it. The mRNA vaccine gives you a little genetic sequence of the virus, and essentially your host cells produce that protein. So it's all different steps of the same thing, but your immune system is just being exposed to a little piece of the virus protein, which can't cause infection, and then your immune system reacts. So if it's one company or another company, your immune system doesn't really know. It just sees a piece of this coronavirus and responds to it. So there's no problem crossing. Whether it'll affect passports and crossing borders and all of that, there's been headaches. I know people got AstraZeneca and crossed to mRNA, and now they're having problems getting to the UK, where they received AstraZeneca from the UK and they received a different AstraZeneca that was manufactured in India, and they wouldn't accept that. So those I would consider in the political realm, and very hard to predict or answer those. So I'm sure some people have frustrations with that, and there's not much that I can answer about.
Thank you again. I think the next question is coming back to you again, Dr. Katz. I think I also want to preface this by saying that the general public, I think, has learned lots of new terms that have become part of our conversational style now, including variants. And I think people will have questions about what might be the new variant to develop, how do variants develop, and right now, how concerned should we be about the new C12 variant?
Yeah, so these variants of concern, I mean, the name sounds scary, right? Variants of concern, it's a very worrisome title for them. Essentially, viruses, particularly RNA viruses, there are DNA viruses and RNA viruses, their goal in life is just like Darwin would say, it's to propagate, and then evolution is having kids and next generation, and it evolves over time. Viruses are the same thing. Their goal is just to reproduce their genetic material. And as they do that, they make mistakes. So if the sequence should be CCTGCG, then it'll CCTGAG, and it'll accidentally insert another base pair into the alphabet. And that just changes the little protein sequence when it makes the virus, and then your immune system doesn't recognize it as well. It's just an accident, but there are billions of viral particles. And if you make an accident that leads to more success, then that child will have more children and will create more virus particles. And then all of a sudden you've gone from the Wuhan strain to the alpha strain, and then you have another accident, and the alpha strain becomes the Delta strain because it's gaining fitness. So I think the natural trend will be that this virus will continue to evolve, just like the influenza virus, the seasonal influenza virus. And it hasn't really happened too much yet, but it will eventually start to escape the vaccine. But we just need to understand what that means. Escaping the vaccine once you've been vaccinated or once you've been infected means that you'll be able to become infected with it again, but because you have some immunity from the first infection or from the first vaccine, it will behave like a virus that your immune system is a bit familiar with. It'll be a human virus instead of a bat coronavirus, because it's been humanized. You've seen it with the vaccine, or your immune system's seen it with the infection. And so the risk, once it evolves and escapes from this year's vaccine, will be to just cause a mild infection, just like the common cold virus or seasonal flu. Most of us in our midlife years weren't nervous about influenza year after year. We would get shots just to prevent missing work and our kids getting sick and all the whole cycle. But it didn't cause severe disease. So we'll get into that cycle where it continuously drifts and changes, and we'll need probably to get annual or biannual new vaccines, but it won't cause big waves of pandemic. It will just cause seasonal influenza type problems.
Okay, thank you. It's a lot. You squeezed a lot of information into that answer. And I'm gonna skip back, I guess, and think more about kids, because I think lots of us who've been vaccinated are now worrying more about those of us who are unvaccinated, and that's for the most part people under the age of 12. So if and when, I'm going to say when, not if, that's how I'm going to think about it, when the vaccine gets approved for this younger age group, what could that rollout look like for children under 12? Dr. Maraka, would you like to start?
Sure. So, we anticipate that rollout will be similar to what we've done so far and build on the learnings from the different types of clinics that we've offered so far. Again, we're partnering with Toronto Public Health, so we hope that, there'll be some school involvement, whether it might be after school or some type of school-based activity, because it would be nice to get the students where they're at. We'll continue some of the small-based clinics in the local community centers where it might be easier for parents to take their children. Some of the mass clinics will continue through public health that are already in existence. And then some family physician offices and pediatrician offices may be providing the vaccine as well. So it's always good to have that discussion with your primary care physician first when the announcement is made that we're ready to go forth, see if they are able to offer the vaccine at that time, and then decide where it might be easiest and most convenient for your children to get the vaccine.
And for Dr. Kanani, what are you thinking about this? I'm sure this is top of mind for you for this patient population, the younger kids.
Yeah, I agree with what Dr. Maraka has said. I mean, there is some planning going on around how we would do this for the children when it becomes approved, because I think it will get approved. I think that, a parent would need to be present at the time. So we just need to think of how that would work. I mean, after school might be a good venue. Like there were pop-up clinics in schools where, kids could get their vaccine done there. But I think it has to be multiple options for families. So I think it'll be available in multiple sites. There won't be mass vaccine clinics necessarily for kids, but the other locations would be good.
Okay, thank you. I'm going to come back to you, Dr. Maraka. For pregnant people, this is, I know, again, a topic that's top of mind for many people. What does the evidence say about how safe a vaccine is for this patient population?
Yes, I get this question a lot from my patient population with women who are planning to become pregnant, already just pregnant. We know that pregnant individuals should all be offered vaccination, and at any time during their pregnancy or while they're breastfeeding with one of the Health Canada approved vaccinations. Lots of data has emerged both nationally and internationally from large studies demonstrating that about 10% of pregnant women will require hospitalization as a result of COVID infection, and about 3% will need ICU admission. We've known this even with other viruses like influenza and I think it was SARS and H1N1. Pregnant women with their relative immunosuppression are at higher risk of getting more sick with certain viruses that they might not be as at risk if they weren't pregnant. We've also seen with this particular virus that there is an increased risk of preterm birth associated with COVID-19 infection. This obviously will cause potential complication to the infant that may be related to prematurity. Lastly, we do think in theory, and there are some studies that are supporting this, that there will be some passive immunity. So that means if a woman develops antibodies to this infection, some of those antibodies will pass through the placenta into the fetus, which will then be protective to this baby upon birth during a time when the baby's at high risk because of their small size and immaturity in terms of their immune system, and because they can't be vaccinated just yet. So there is some evidence demonstrating these antibodies in the umbilical cord blood. And we already do this in terms of pregnant patients being offered pertussis vaccinations and flu vaccinations during their pregnancy to protect them, but also confer some of that immunity to their baby. So lots of good reasons why pregnant women should get immunized. And so far, no long-term evidence. I've had lots of women getting vaccinated during their pregnancy, recently delivering, and doing just very well.
Because it comes up a lot around fertility. People are wondering whether the vaccine causes negative consequences around fertility. If you trace back all of the internet chatter around this, it goes back to one single individual in the United Kingdom, a so-called researcher who essentially just put out some theory that has no substance to it, and it's just gotten lots of coverage and legs on the internet. It is not true. There's no scientific basis for it, and there's no evidence that that's the case.
I think that question also comes up around fertility with young people. So I think it's important to emphasize that it really does not affect fertility, but I've heard that a lot with teenagers too, and with young adults, where they're worried about fertility for young people. People are worried about, is it going to affect them when they're older? But there's no science behind that. So I agree with what you're saying there. And also in terms of the pregnant women, I also get this question a lot, and definitely we would recommend it for pregnant women. So I agree with what Dr. Maraka said.
Yeah, thank you for jumping in with all of those ads, because I do hear it in my line of work too, questions from our readers who want to know that it is safe now if they are trying to become pregnant or are pregnant, and for future fertility. So thank you for those thoughtful answers. I think we have time for one last question. And it sort of circles back to what we were talking about right at the beginning, that all of you received your vaccination early on in the pandemic. So early on in 2021. But it's a hospital's vaccine policy has now come back into focus. What is the vaccine policy currently at North York General? And I think someone is curious about why do you think there are healthcare workers in the province who have chosen not to be vaccinated? Dr. Katz?
So this is an area that is rapidly evolving. I would say that a large number of hospitals just in the past 10 days or so have implemented mandatory vaccination policies for their staff. Probably going back a couple of months, new hires were required to be vaccinated. But now, effective the end of October, people need to be fully immune. So 2 weeks past the second dose by the end of October, meaning that they need to receive their first dose by this Friday, so that they'll have 2 weeks after their second dose if you do the timing by the end of October. And in the interim, the government put out a provincial directive, Chief Medical Officer of Health did that, called Directive 6, which requires testing of healthcare workers using the rapid antigen tests asymptomatically in those that are not yet vaccinated. So I think, certainly in North York's region, the central region, all of the hospitals moved together. Downtown, UHN, a bunch of other hospitals are doing it. It's sort of catching on, and more hospitals every day are implementing this policy with a lot of support from different large groups. Why? The why is a very complicated question. I think just like we started off when Dr. Maraka was saying that you need to probe on what the reason is for each person. I think that's true for healthcare workers. Some of them are afraid of needles. Certainly there are different groups that have different reasons. There's individual reasons, but then among groups, there may be people from certain backgrounds where there has been negative interactions with the healthcare systems because of systemic racism in the past. Just a whole host of complicated, long-standing issues. And all of those are sort of being pressurized in a short period of time to be dealt with, which, generally like to have a nice long conversation over a long period of time to sort through these things as a society. So yeah, I think it's complicated. At North York, the physicians double vaccinations is about 98%. Among the general staff, it's probably slightly lower than the provincial average, and very complicated thing to know why that is for each group, each person.
Okay. Thanks very much. I just looked at the client time and our hour is passed up. I know people had lots of questions, and I want to thank all of you for taking the time to respond so carefully and thoughtfully on what are really complicated and sometimes emotional issues for people. So thank you very much. We always like to do sort of a wrap up, give you the chance to say a final word before we say goodnight. Dr. Maraka, why don't you jump in with your final thoughts before we say goodbye?
Sure, thanks, Megan. I guess I'd like to just remind everybody on the call tonight that primary care, your family physician, is still here and open, ready to see you. A lot of the screening that we would normally have done through the pandemic has been put on hold, and we're quite concerned about this in terms of mammograms for breast cancer and colon cancer screening, even things like checking your blood pressure regularly and getting some blood work to screen for diabetes and high cholesterol. We were all fearful of going out, and especially going to a medical facility where you might run into the virus. And even as physicians, we were, we had an approach of virtual first, again, to reduce transmission among patients and then to healthcare providers. Now that many of us have been vaccinated and we're all well versed in terms of infection control procedures in our offices, we do like to ensure that patients do return to us. Reach out, maybe have a phone call first to see what you could do on the phone, but then make sure that a lot of these health prevention strategies do resume and you get screened for diseases that we should have done months ago, so that other types of infections, diseases don't fall through the cracks. We'd like to see you, especially also if you have any further questions about getting vaccinated. We're your trusted source. We've known you for a long period of time. And so a lot of you may have more ease and comfort chatting with us about your fears and underlying concerns about getting vaccinated. So eager to hear from you, eager to see you and care for you again.
Thank you for that. Dr. Katz, do you have your final thoughts?
Yeah, I'll try to, there's been a little bit of a down tone to all of this. I think we're all done with COVID. I'll try to take a positive ending to it. I think that we really need to be unbelievably thankful that we're in 2021. Can you imagine going through a pandemic without Zoom and cell phones and being able to actually interact and not be completely isolated from others for such a long period of time? The ability to produce life-saving vaccines in such a short period of time and roll it out, manufacture it in such amazing, vast amounts. It really is fantastic. The fall may not be glorious. I do think that that once this is done with the vaccine passports and vaccine mandates and the kids going back to school, and as Dr. Kanani and Maraka were saying, the vaccines for kids are likely to come soon. I think beyond that, we really do need to start getting back to normal. We will start getting back to normal. And so it takes work. I haven't not been to work or the lab or the hospital. I've been there pretty much almost every single day going back to the beginning. And I said how great it was to be able to do that because everyone else was sitting at home, overthinking and driving themselves bonkers from loneliness, which is such a terrible thing. We really do need to to get back to normal once these COVID numbers come down and everyone's vaccinated, because otherwise we're going to have a huge mental health pandemic that we're going to have to work through. We may have that anyways, but I think we're on the cusp. So hopefully light is at the end of the tunnel, and I know we said it was done before, but hopefully it really is done this time.
Okay. And lastly, Dr. Kanani, let's hear from you.
Yeah, I mean, I agree a lot with what Dr. Katz was just saying. I mean, I remember back in January 2020, Dr. Katz had come to one of our leadership meetings and said the pandemic's coming, it's going to last 2 years. And I think a lot of us didn't really believe it, but I think we have come quite a long way in 18 months. So I think we do need to be positive. We're getting to that 2-year mark soon. And I think this will end and life will go back to normal. So I agree, we need to be positive and be thankful.
Okay. Well, once again, thank you to each of you for your time and your thoughtful responses. And I also want to thank the audience. I can't see any of you out there, but I know that there were hundreds tuning in to ask questions of these experts and to listen to their thoughtful answers. So thank you for your time this evening as well, and for sending in questions that I hope we answered, at least in some way, for you this evening. I've really enjoyed being the moderator. I get to ask a lot of questions for my job, but this is a different way for me to do it. And I'm happy to try and help those of you listening get some of your answers directly from the experts tonight. Okay. All right. So thanks again, and all the best.